We will shortly have our valedictory program of the vascular nursing, the journey unfolds workshop. We welcome you all to join the valedictory program of a workshop on vascular nursing, the journey unfolds during VICON 2022. Just to go through what has happened in the last 2 days, we've had various sessions on the care of patients with arterial and venous disorders presented to us by experts in the field. We had vascular nurses speaking to us. We also had talks by Dr. Mehta, who spoke on stockings. And today we looked at the amputee pathway, and we also heard the experiences of people in setting up vascular clinics, vascular nursing specialty in CMC Vellore. Hope you all had a very fruitful time over the last 2 days. I would now like to, in the last 2 days, we also had a couple of competitions held. We had paper presentations which were held during the workshop. And may I now take the opportunity to announce the prize winners of the workshop. Sorry, prize winners of the paper presentation. We had many paper presentations, abstracts sent to us. And the judges for the oral paper presentation were Dr. Nihar, who's a senior consultant surgeon at the Apollo Hospital, Hyderabad. And we also had Dr. Sheila Durai, who's a HOD professor in College of Nursing, CMC Vellore, and Ms. Hannah Joyce Rossi, who's a corporate nursing initiative lead in IHH Healthcare India. These were our judges for our paper presentation. And I would like to take the privilege to announce the results. For the paper presentations, the first place goes to, can you please? Ms. Malini Rachel, she's from CMC Vellore, and she had presented on a descriptive study to assess the quality of life of patients with chronic leg ulcers. Ms. Malini Rachel. The second place goes to Ms. Mandeep Kaur. She is a tutor from PGI Chandigarh, and she had presented on incidence of thrombophlebitis among traumatic brain injury patients getting mannitol infusion. Ms. Mandeep Kaur. The second place is also shared by Ms. Naujat Kaur from Fortis Mohali. She's a vascular nurse specialist there, and she had presented on experience with laser and topical treatment in diabetic onychomycosis, a 6-month follow-up of 25 patients. Ms. Naujat Kaur at the second place. At the third place, we have Mr. Vishnu, who is a 4th-year BSc nursing student at the JSS College of Nursing, Mysuru. And he had presented on knowledge of police personnel regarding varicose veins. Mr. Vishnu at the third place. Congratulations to all the winners. Well done. Well done to all the participants. We also had another competition on e-posters on home care of patients with vascular disorders. So there we received many e-posters on that. And then the judges were Mrs. Jaslina, who is a vice principal of Apollo College of Nursing, Chennai, and Mr. Pierre Edwin, faculty in physiotherapy department, CMC Vellore. And the prize winners are, the prize winners for the e-posters on home care of patients with vascular disorders are, the first place goes to Ms. Angelin Sudhakar, who is a nurse manager in CMC Vellore. The second place goes to Ms. Shakina Esther Rani, nurse manager again from CMC Vellore. And the third place goes to Ms. Sarah Jane, staff nurse from CMC Vellore. Congratulations once again to all the winners, and well done to all the participants. Thank you all for your very active participation. We will now have feedback about the workshop. It's nice to hear from the other side about your experiences and feedback for us to improve on things to improve during the workshop. May I please call upon Ms. Naujot Kaur. She is a vascular nursing specialty nurse from Fortis Hospital, Mohali. Can I please call upon her to give her feedback?
Good afternoon, everyone. I am Navjot Kaur, vascular staff nurse at Fortis Hospital, Mohali, Punjab. I am working in vascular surgery department from last 7 years. It's a very good branch for growth. We have approximately 15 experienced staff nurse. Vascular department is a very good. I am very happy to join Nursing Symposium in 15th Annual Conference of Venous Association of India, VICON 2022. It's very innovative and knowledgeable. Thank you.
Thank you, Ms. Naujot. May I also call upon Ms. Angeline Sudhakar? If you're on Zoom, can you please give in your feedback?
Yes. Yeah, it's thank you for this opportunity. It's my immense pleasure to give the feedback on behalf of the participants. So the 2 days, actually, it was a very good experience that we had as a participant. I was able to learn many things, especially the whole workshop was well organized, and though it was an online, we missed the opportunity to attend directly, but still it was a well organized workshop, and the information was in depth. I would actually say that we had to grasp points to write quickly so that we don't want to miss any of those. So it was really an elaborate information that was shared by the experts, and we had really gained our in-depth knowledge, especially in the pre-test. What we had was a lot of questions in our mind, but everything was cleared in the post-test, and I think everyone would have scored more than 80% in the post-test. And also, the practical points were discussed very well. That is the demonstration. We could see how we can do it. That was an excellent thing that we were able to see, observe, and learn. And also, I think the organizers had done a real good job about it. And I extend my sincere gratitude and thanks to all the organizers of Surgical Nursing Department of CMC Vellore for giving us an opportunity to do this, along with the Vascular Surgery Department. And it's my great gratitude that I would like to express. And this was a great learning. Thank you for that, in Jesus' name.
Thank you, Ms. Angeline. We now come to the most important part of this valedictory program. Today, like we mentioned before, this is a dream come true for the vascular surgery unit at CMC Vellore and the vascular nursing specialty of surgical nursing department at CMC Vellore. I'm sure all of you will agree that this dream was not conceived just today. It dates back many years ago. The dream of forming a vascular nursing society of India. This was a dream that spanned over almost 10 years, and it has come to a reality today. And we are very proud to launch the Vascular Nursing Society of India. And may I now invite Dr. Sheila Durai, who is the head of the Department of Surgical Nursing Department, to take over and introduce about the Vascular Nursing Society of India.
Good morning, everyone. On behalf of the Vascular Nursing Specialty and the Surgical Nursing Department of CMC Vellore and our nursing fraternity around India, I would like to invite each one of you to this program. I would like to tell you that this dream was something which was there among the vascular surgeons and the vascular nursing nurse manager, that was Ms. Ida Nirmal. And we had Dr. Punita Elilarasu and Dr. Pramila Lee also deliberating on this. And we are thankful that at this time, this has come into fruition. So what is our philosophy. What do we believe in? When we had the planning for this conference, though this had been on the pipeline for a long time, Dr. Deepak, Dr. Prabhu, and Dr. Vimalan, with their support and with their motivation, we were able to go forward with this formation of the Vascular Nursing Society of India. So what we believe, can I have the next slide? Yeah, so we believe that functioning as a society is essential to network, collaborate, and strive towards advancement of vascular nursing as a science, and committed to the goal of enhancing the outcome of patients with vascular diseases. And we also believe that vascular nurses are to be empowered to function independently to provide evidence-based, technologically precise, compassionately delivered advanced nursing care, and incorporate education, management, and research as a part of their specialist nurse roles throughout national and international advocacy. And our vision is, so the VNSI seeks to further vascular nursing as a science through excellence in patient care and collaborative network for the advancement of vascular nursing through education, management, and research. And what are our objectives? Our objectives are to promote vascular nursing as a science and to have research collaboration pertaining to vascular nursing, education and diffusion of evidence-based vascular nursing knowledge among nurses in India, the advancement of vascular nursing skills, and health education of the masses in prevention of vascular disorders. So these, I know, sometimes look like lofty aims, but I know with the help and support of the vascular surgeons in India, we would be able to take this forward and establish this as a vascular nursing society. And we want to make sure that we can capture data to show that it has made a difference in vascular patients with vascular disorders. I now request Dr. Deepak Selvaraj to come and introduce the.
Thank you very much, Sheila. And this is a very historic occasion for all of us. It has been, the Vascular Nursing Society of India has been a dream, and it has been a pipeline for a long time. And somehow things were not getting, there was the stars weren't aligned properly, but now it suddenly it's taken the institution, the Christian Medical College, which is a pioneer in vascular in nursing, teaching and setting principles and goals, have actually come forward and said that this is the right time to go ahead with the Vascular Nursing Society so that we can interact with vascular nurses across the country and set standards and set standards and take vascular specialty nursing in a big way. So as we see in our specialty, in most of the work in the vascular department is actually done by a group of nurses. And all we do is just go in between, we just go, if somebody had actually listened to the setting up a one-stop vein clinic talk that I had given yesterday, the role of a surgeon is actually very, very little. So the whole entire thing of clerking patients, bringing him inside, post-op care, and everything is done by the vascular specialist nurses. So they, even in the outpatient clinic, they have a very special role. They even do a screening for all the AV access. They look at the groins for if there's any problem post angiograms. They do ankle brachial pressure index. They give them quality of life advice. And we have something called an amputee pathway, which once we do an amputation, they just take over. They just come in and seamlessly take over, and then they look at they inquire about the patient's housing requirements, and disability surveys is being done by them. So they make their life so much more easier. And it is time as we help them to form a national society so that they will grow by themselves. And that is the whole idea. We want, and there will be interaction across Fortis, Apollo, and you know what? We have vascular surgeons all over the country, and we want the nurses who work with us on a daily basis also to interact. And I hope what we're starting today will grow. And we've taken a lot of time, and Sheila and on the nursing faculty have actually written up a constitution, bylaws, and everything they've done by themselves, and including the, can you put up that motto, the symbol, the logo? So, yeah, that logo has been designed by them, and you see that lamp at the bottom is actually the lamp of nursing, a lamp of nursing. So this is there are a lot of blue and red as well, and then the Vascular Nursing Society of India. So a lot of thought has gone into all these things, and I hope and I hope and pray that this society gets to grow and their dream is fulfilled. Now I request Rahul and Dr. Bedi also to say a few words, and this will be followed by the official opening of their two international felicitations, and then we will have the next. Rahul, can you come and have a...
Thank you, Deepak. First of all, I really like to say thank you to both of you. You may not be knowing, this was my dream from 8 years. So we had the logo designed in 2014. What? No. And we had a very, very active nurse. So unfortunately, she didn't took up my dream, and she was so active in vascular surgery that she used to teach all the vascular surgeons who used to join my unit. And she had performed more than 1,000 laser procedures independently. And you will not believe, she actually learned so fast, she became like me at doing EVLT. Unfortunately, she has gone and joined the vascular surgery department. She's heading the vascular surgery in England now, one of the departments. So then Navjot picked up, and when Deepak mentioned me about this, I said, Deepak, this is like dream come true. And whatever department does it, CMC Vellore does it, or PGI. So we were tied up with PGI Chandigarh, but I'll make you tie up with the PGI Chandigarh, and so the head of the nursing there, because I feel that all the institutions must join up. From last 8 years, we have been training 300 nurses per year in vascular surgery in our institution. So we have been doing vascular CME of 8 hours and getting the nurses from all over India into the hospital and train them on all the vascular procedures. So in August every year. So this is really, really very good. And if you know, now gentleman here has become the president of VAI now. So he can, so Deepak is the current president now of the VAI. And so, he can take this, further. And in the executive committee meeting, Dr. Bedi, when he was a president, so we decided to support the Vascular Society of Nursing in a very big way. So I think this will be really very good. And I've already spoken to the IT guy. He is already searching for the domain for you guys. So he will help you in designing the website. You guys just tell him what to do. So we will not come in between. And whatever you want to do with the website, he will just do it. And the VI will pay for that. So you don't have to do anything. I will request one thing, that please, every year, please, not virtual, please bring at least, make sure that you collect at least 30 nurses to be part of YCon every year. We will take care of the registration part, definitely. We will see how we are going to fund, the travel and the accommodation. We have to discuss, that's a slightly tricky part, but we'll see how we're going to discuss that. And I think you should open the bank account open up so that you have the membership fee, a small amount of membership fees, which can be paid by the VI slowly and slowly, so that you got a corpus, and then you can sponsor these nurses every year to the Vicon. We will do part funding anyway, but once you have 30 nurses coming to the Vicon every year and presenting the papers, it should be compulsory for everybody to present something, coming over there. That will really improve your quality of quality of presentations and publications and everything. And in August, when we do the vascular symposiums, and so we are very happy that we can at least sponsor 10 nurses, and who want to come up, learn hands-on. We will be very happy to do that. That is in my hands, so I can do it. So congratulations. Dr. Bedi, please.
Thank you, Rahul, Sheila, Deepak. We depend so much on nurses. We are there for maybe 1 hour, 2 hours, 3 hours, maximum 8 hours. And it's basically you who are looking after. So I'm so happy that you have decided to form a special niche of nurses. And we, as I said, we lay great importance. Even when I was in CMC Ludhiana, the nurse would be an integral part of the team. And I learned this from when I was in Sydney. We would look, 4 of us, 5 of us would be seeing a patient, small kids, doing an arterial switch. And everything CVP okay, blood pressure okay. And then just as we were moving on, the nurse would say, sir there's something icky about this patient. And then my professor would stop and he would go back, and then more often than not, we would find out what that icky was, which that nurse picked up, which we did not pick up. So we depend a lot on you, and God bless you. And one more thing, that one of our very good colleagues, Dr. Ray Burgess, has donated 50,000 through VAI for your association, which Dr. Deepak, I'm sure, will be letting you know. So flit on, cheering angels, and God bless you.
Thank you, Dr. Deepak Selvaraj, and thank you, Dr. Rahul Jindal, the past president of VII, Dr. Harinder Singh Bedi. He was the president of VII, and I just heard from you that Dr. Deepak has taken up as president now. Thank each one of you. As I'm listening to all of you, and yesterday I was talking to Dr. Prabhu Prem Kumar, who actually connected me to the vascular nurse practitioners at Australia, and I've been in touch with them. And he also had mentioned that it was when he came back from Australia, it was his dream that a vascular nursing society of India should be formed. And it looks like there have been these small sparks of, desire to start off a society, and it has all accumulated. It's all come together with the cumulative effort of everyone. And we are really happy and grateful to the Venous Association of India for all your efforts to take this forward. I would now like to request Wendy McInnes. She's the vascular nurse practitioner at Queen Elizabeth. She was working at the Queen Elizabeth Hospital, Adelaide, and now she works at Lyle McQueen Hospital. She was the past treasurer and president of the Australian and New Zealand Society for Vascular Nurses, and she brings greetings from them.
Hi, everybody. My name's Wendy McInnes. I'm a vascular nurse practitioner in the Northern Local Adelaide Health Network in South Australia. I'd like to say thank you, Sheila, for inviting me to say a few words today. Very exciting times for you all to be getting together and looking at your journey as the vascular nursing journey unfolds with your workshops, but also the development of the Vascular Nursing Society of India. Congratulations on this. This is so exciting for you all. It's a time for you to all get together to develop some information, share information and education, share your skills, teach each other, learn from each other, make friends, network, and also enhance nursing as a profession. It's a time for looking at the specialty of vascular nursing and forming some international collaboration. So best of luck with your workshop and good luck with your journey. Thank you.
Thank you, Wendy. We also have greetings from Frank Kiroro, the present president of the Australian and New Zealand Society of Vascular Nurses.
Hello, my name is Frank Guerrero. I'm the current president of the Australian and New Zealand Vascular Society of Nursing. And I'm also currently employed as a nurse practitioner in vascular surgery, working in South Australia at the Flinders Medical Centre, along with the surgical team there. I'd like to say hello and welcome the vascular nurses of India. I'd like to welcome the workshop participants and thank the organisers for their efforts today of putting this together, and also make a special mention to Dr. Prem Kumar, who I believe has been working hard in the background putting this together. So I'd like to extend you all my words of encouragement and congratulations on the formation of the Vascular Nursing Society of India. What a fantastic achievement. I'd like to extend my support and ongoing collaboration to Sheila Durai and the Indian vascular nurses going forward. As a brief bit of background to the Australian and New Zealand Society of Nursing, we were formed in the early 2000s, and we've served as an organisation which has sought to foster and encourage vascular nurses who are interested in vascular surgery specialisation to come together and share their knowledge, support each other's professional development, and also strengthen our relationship with the surgeons. I look forward to hearing more about the Indian vascular nursing experience, keen to hear more about how things are done over in India and what differences may exist between ours and what similarities as well. Finally, I'd like to extend an invitation to the vascular nurses and also the vascular surgeons of India that we are having our joint vascular surgeons and vascular nursing conference in October this year. It's happening in Tasmania, which is a beautiful part of Australia. It'd be worth coming to see. It's absolutely gorgeous. It's being set in Hobart on the 21st to the 24th of October. And I'd like to extend our discounted rate to any of the Indian Vascular Nursing Society members to receive our discounted rate. So look, all the best. I encourage you to go forward and share your knowledge and share your experience and forge a future in vascular nursing. All the best.
Thank you, Frank and Wendy. We're really happy to work with you. Our founding president of the Vascular Nursing Society of India is Dr. Pramila, through whose advice and guidance we were able to come thus far. And along with the founding vice president, Mrs. Ida Nirmal, we will be having a collaborative meeting next month to put down plans and short-term goals on how we can network and collaborate together. I now call our vascular nurses to come forward as Dr. Deepak Selvaraj and his team, they come forward to unveil the plaque of the Vascular Nursing Society of India and declare the opening of the society.
Thank you. Thank you, Sheila. Can Dr. Jayakumar, Rahul, and Dr. Bedi please come to the podium? And I request Dr. Jayakumar. It's an honor that he is here today. He has been held several posts. He has been the secretary of the Vascular Society of India, and he has been a mentor, a guide, and he has been the dean of Tanjavur Medical College and the director of vascular sciences in Tamil Nadu. And it is a pleasure and honor that he is here today in this important day where we are going to officially launch the Vascular Nursing Society of India. I request Dr. Jayakumar to open the plaque.
This is the opening. As the founding member of the society.
Thank you to all of you, and we continue to depend on you for your support and encouragement. I now request Hepsi to take over.
Wow, what an amazing moment that was to launch the Vascular Nursing Society of India. Thank you once again for being a part of it and making this day a very special day for all of us. We now come to the end of our workshop. May I please request Ms. Renee Wills to give the vote of thanks. Ms. Renee Wills.
It's my privilege to propose the vote of thanks on behalf of the surgical nursing team, CMC Vellore. First of all, I would like to thank God Almighty for His presence throughout the workshop. We extend our heartfelt thanks to the organizing committee of the Venous Association of India for making this happen. I would like to thank the vascular surgery team, Dr. Deepak, Dr. Prabhu, Dr. Vimlan, and the entire team for their constant support and encouragement, and for giving us this great opportunity to conduct this workshop. I thank our Dean, Dr. Vatsala Sadhan, College of Nursing Dean, Dr. Bala Sitaraman, our Nursing Superintendent, Dr. Pramila Lee, our Advisor, Dr. Sheila Durai, the Organizing Chairperson, Ms. Hepsi Raju, Organizing Secretary, Mrs. Aida Nimel, for their ever-present guidance and valuable suggestions in making this workshop successful and productive. I would also like to thank all the resource faculty who have put in a lot of effort to ensure that new knowledge is imparted. I would like to thank all the participants of the oral paper and e-poster presentation for your enthusiastic participation. I also extend my thanks to all the judges for taking their time off. And as you all know, we have launched the Vascular Nursing Society of India, and we sincerely thank the Venous Association of India for being so supportive, and we wish to take it forward. And a special thanks to Ms. Meenakshi, Ms. Neeta, and their entire team for the technical support, the arrangement, the transport, and for making us stay comfortable here. I would like to thank one and all for making this workshop a great success. Thank you.
Thank you all for journeying with us for the past 2 days. Hope you all had a wonderful and fruitful time. Thank you all for joining. Have a nice weekend.
Good afternoon, everybody, and welcome to the Hemorrhoids Conclave session of the 15th Annual Conference of the Venous Association. You all probably wondering what are we talking about hemorrhoids in a venous conference, but actually these are two conditions that frequently coexist. So many patients who have hemorrhoids have also been shown to have venous incontinence if you actually ask them a history of symptoms suggestive of that. So it's not really strange to find this session in this Venous Association conference. I'd like to welcome all the delegates to this meeting. I'm Dr. Ranjan. I'm a colorectal surgeon from Christian Medical College, Vellore, and we are going to have this over the next 1.5 to 2 hours. Have a discussion on the management of hemorrhoids, which is one of the earliest recognized maladies that has troubled human beings. And so we have, and particularly we are going to be concentrating our discussions on a fairly new technique that has evolved for the treatment of hemorrhoids, which is using radiofrequency ablation. We have Dr. Jignesh, who's an expert of sorts in this procedure, who's vastly experienced in performing this operation. And we have Dr. Vivaldi, who will be joining us via link later on to participate, to deliver a lecture, show us some demonstrations of the operations that he's done, and also take part in our discussions. So without delaying this session any further, I'd like to start it off by calling Dr. Deepak Selvaraj, who's the conference organizer, to start off the proceedings.
Good morning, ladies and gentlemen. First of all, I must thank you all for being able to come to this beautiful city of Mahabalipuram, which is a very iconic city. It's got a long history. Thank you for coming from all over the country. And I must really thank Novomed for all the effort that they have put in. As the organizing chairman of this conference and the president of the Venous Association of India, I would like to say that this was a dream for a very long time. And we know that there's a role for radiofrequency ablation in hemorrhoids, but we were just not able to get the right people to actually come and teach us the procedure. And we had a very strong colorectal department in CMC. They do a lot of extensive high-tech work, but somehow we are not able to concentrate on this particular thing. And that's when Dr. Jignesh came in. He came to Vellore. We had a small CME there, and we actually showed us how the whole procedure is done. We operated on, say, 3 or 4 patients on that day, and there was a large attendance there as well. And thank you so much, Dr. Jignesh, for coming forward and helping us as we kickstart this program. And once again, welcome all of you, and please enjoy your stay here with us. Thank you.
Thank you, Dr. Deepak. So to begin our discussions, I'm going to call on Dr. Rajat Raghunath, who's an associate professor of surgery in Christian Medical College, Vellore, who also works in the colorectal surgery unit. And he will give us a broad overview on the management of hemorrhoids, which will give us the platform on which we can build up our discussions and deliberations for the rest of the afternoon.